This Chuck Ryan, I'm the Chuck in the Markets Up, Chuck. You know, a lot of talk here recently about the healthcare reform and, you know, the current president making bunches of speeches and talking about, you know, how and what different kind of iterations of healthcare reform might take. So I thought it would be kind of fun to take a look at a couple of companies that I believe are going to be beneficiaries of healthcare regardless of how the ultimate bill or the ultimate plan ultimately shakes out, because these are companies that are, as I said in the written part, part of the solution, not part of the problem. The first would be Teva Pharmaceutical, which is an Israeli-based ADR, but it does the majority of its business in the United States. It's the world's largest manufacturer and producer of generic drugs as well as others. I want you to notice when you look at this chart, and again, I always say a picture you know, speaks 1,000 words. You can see the earnings line, which is the green line here with the white triangles. This company has had a very strong 29.1% earnings growth rate over the last 11 years. It has a real strong balance sheet with only 25% debt. If you look at the company's track record, you know, it has outperformed the markets dramatically. $100,000 invested in this company. We've averaged over 20% a year since 12/31/99, where the S&P or the stock market only did minus 3.5 compounded, where you'd have lost 30%, almost 30% of your money in the S&P. You'd have, you know, increased it almost six-fold by owning Teva. So the point is, it's not about the stock market. It's about the individual companies you own. And Teva is certainly, you know, a good example of a company that I believe is extremely well positioned with a lot of branded drugs coming off of patent, as well as a government that's committed to reducing health care costs. Teva is extremely well positioned for the future, but as I caution you, always do your own homework. Next two examples are going to be one large and one small pharmacy benefit management firms. First is Medco Health Solution, a recent spinoff from Merck. Since they've been spun off, you can see their earnings, you know, really towards the end of calendar 2003 have grown at over 22% a year. Once again, they have a terrific track record. $100,000 invested in Medco when it was spun off would have grown to over $415,000. That's a 26.6% compounded rate of return over the last approximately 8 years since August 29th of 03. The S&P 500 during that same time frame would have averaged less than 0.5% compounded. So obviously, you know, a great long-term buy. The company's trading at a slight premium to its growth rate, but it's certainly very attractively priced given the enormous amount of growth potential it has. It's the largest of the two I'm going to show you, a large-cap pharmacy benefit management company, but this company is a company that basically makes its money and gets its best profitability off of generics, which we believe obviously clearly is where the future is going to be in pharmaceuticals. My last example is Catalyst Health Solutions, a much smaller version of Medco with a twist. They actually price things differently. The company has no debt in the balance sheet. As you can see, they've had impeccable earnings growth of over 30% a year, and there's a lot of room for growth in this company with only a $1.24 billion market cap. It has it has the best track record of all over the last 8 years, where since 12/31/02 it would have turned $100,000 into just under $700,000 versus that's a 33.7% compounded return versus 2.6 for the S&P. As you can see, it's very reasonably priced, trading approximately at its growth rate. I wouldn't call it excessively cheap, but it's very reasonably priced relative to what its forecast growth is. And, of course, on a historical basis, it's extremely cheap. Again, I encourage you to do your homework. These are three, I think, real good examples of companies that can benefit from healthcare reform. They're trading at reasonable valuations, you know, for the future, and with all the growth potential in healthcare because of demographics, as I mentioned, these could be really great choices. It's Chuck Harmel. I want to thank you for listening. Do your own homework, but I hope this gives you a good start. Thanks.